So one of the very first questions that we had at the beginning was, how do you, if you've got a really big report, this was from Judy, how do you tailor that report to make the information easier to find? So if you've got 600 or 300 or 100-page report, we saw some suggestions come in, but Bruce or Katrina, do you have any comments on this?
You know what, I can start just really quickly by saying it's really hard. And it's something we've struggled with as we're putting together this provincial template for our community health assessments in Manitoba, is just how do you break that up. And I think I'm not good at listening and reading, so I haven't followed the chat box really well, but I think there was a suggestion that, you know, use chapters and kind of break it down and things like that. And we've chosen to try to do ours a little bit around sort of social determinants of health and some of those things. So I think you're exactly right. You kind of need a framework. I think even if you're doing a paper report, almost trying to do what that Saskatoon report did, where you sort of start at a high level with an executive summary or something, that if that's all you need and you see what's in the chapter, and then if you want to dig deeper, you can kind of do that. But especially with a 100-pager, it's pretty hard.
Yeah. Yeah. Okay. It is hard. I think, you know, what some people have said to me is if you've got very clear sections and very clear headers, some people respond to color, and I know your group, Bruce, is working on that kind of thing, right, to make it visually quicker to flip through. But, you know, is that then maybe a caution to try not to rely on that as the sole report type?
So I think totally that's where you have to tailor something to your audience, where it's an infographic or a short report or whatever. The other interesting discussion we had in Manitoba around that, I don't want to take too much time on it, but it was just, it is neat to have a real designer, right? Because the real graphic designer said, yeah, we'll use, you know, these colors at the top, and we move this to the right side and this to the left side, and this way will catch people's attention and they'll understand it. And then it was good to have some number people too that said 1.1.3, 1.1.4, you know what I mean? And that speaks to some people too. So it was good to have both of those perspectives trying to get it together.
Cool. Okay. We had a question from Leanne. Any tips or examples for engaging diverse groups into an assessment report or into those processes? And I think this was around, and Leanne, comment in the box if I'm wrong on this, but I think this was a little bit in thinking, how do we engage people who have lived experience, or what I like to call grounded expertise, with inequities, and how do we engage communities in that? And so, you know, the truth also is with data that some communities there isn't enough in terms of numbers to report on something statistical. So, you know, one of my ideas around that is to integrate stories and to add stories into your different reporting products, stories direct from the community, stories from practitioners or partner organizations that work directly with the community. And I think there's also ways to get community members involved in data collection. And again, understanding it might not be, now I'm a qualitative mind, so I understand it wouldn't be large in terms of members to report statistically, but does it give it the numbers of depth? Does it give some context for how stats apply? So that was my idea, but what do the two of you think?
Katrina, this is more your wheelhouse. You got to go first.
Yeah, I think there's so many different ways it can be accomplished, and it has to start with right from the very beginning, deciding that something warrants attention is an act of inclusion or exclusion. So if we are really genuine in our desire to, for example, respond to housing or issues, or respond to Indigenous issues and their concerns, then we need to it needs to start from a relational place and look at using an integrated approach where we use real conversations and plan with people from the start and carry it through. And I've done this in a few different projects. I worked years ago, I used to work in street outreach in Saskatoon, and we did survey research with our clients. And it was a simple study, but we started by having some casual conversations to say, you know, do you think that it would be a good idea to, like, how could we learn more about how well our program is meeting your needs? And to just have some casual conversations, it was clear that there was an interest in paying some attention to it, and maybe we weren't meeting needs as well as we could be, and we wanted to. And so we had, we used some like informal consultation with clients, and we used some advisory group formats to design and develop what kinds of things needed to be paid attention to, what questions needed to be asked, what data was missing. And then we went back to the same groups to find out whether we had asked the right questions and to make sure that our interpretations of the data actually made sense in context, and sometimes they didn't. So I think when you have a strong relationship and you think about creating, like leveraging, so we're all in it together, we're all trying to solve a problem and work towards a more productive, a more fair, a more equitable kind of community. If we really believe that, then it is all of our responsibility. It's not just the responsibility of those of us because we have jobs in the healthcare system. It means we need to have good relationships and partnerships, and I think you really can transform the way that you think about and do the work. It is challenging in a way because it disrupts very, like, I don't know about you guys, but I love the people I work with, but we have like a Monday to Friday schedule, and there's lots and lots of meetings, and so you have to think about how are you going to create an inclusive space where people who don't necessarily fit within the confines of the bureaucratic norms of coming into an office where everybody's dressed up in business professional clothing and expects to sit in a meeting room with a teleconference. Not everyone is going to feel comfortable or feel like they have a voice there. So you have to be creative and willing to create spaces that are more comfortable and actually meet the people who need to and should have a voice at the table. It should be designed around them and their needs, not necessarily the researcher or the epidemiologist or the KT expert.
Yeah, very good. Can you, Katrina, there was a question during your presentation about how the approach takes gender into consideration. Do you have a quick answer for that one?
Yeah, I think the example of how quickly gender, so I think gender needs to be considered with other intersectionalities. And so, for example, the one I gave when we were talking about opioid overdose was the intersection between gender and indigeneity. So if we looked at data only by men and women, and we didn't look at any other intersecting ways of analyzing that data, we would draw attention, like the greatest need would go to middle-class men who use alone. That was the example I was trying to offer there around gender. So I guess I would just reiterate that gender is absolutely important to pay attention to, but we need to pay attention to it along with other intersecting factors that disproportionately place inequities or create more burden for some groups than others.
Okay. We had a question from Leanne, and I think both of you can comment. How do we offer a strength-based approach within reporting? So if communities are disproportionately affected by poor health outcomes, how do you balance that with strength-based messaging of improvement? Bruce or
obviously I don't have a really quick answer ready to go, but I think part of it is just recognizing that right from the start, right? And as you're preparing your report, and not sort of as an afterthought that all of a sudden you read through some of these things and realize that you have, a lot of sort of negative outcomes or negative messages. So I think it's recognizing that and kind of focusing on it. That's not a really one, but it's a start, I think.
I think For me, I'm really inspired by some of the efforts that have been supported by First Nations Health Authority here in BC, where there have been efforts to work really actively with community, their community-led efforts actually, to create different kinds of indicators of things that they want to pay attention to. So, for example, they might be looking at things like how many children are taking, enrolled and actively participating in language classes. How many, I'm sorry, I can't think of another really great specific indicator, but more to the point is that a lot of the indicators that we use to monitor social determinants of health and health inequities are really actually proxy indicators that focus mostly on the symptoms and not on the causes. And globally, we do not have really good indicators to monitor for how systems of power are shifting in society, or how the distribution of wealth, resources, and power, if we want to use the Commission on Social Determinants of Health, there are three major factors that are leading to vastly different experiences of health in the world. So I think we need to collectively work hard at coming up with some better indicators for health equity. What would be, for example, an equity ideal that we would pay attention to? Because really what we pay attention to are health inequities, which are deficits. So the lens that we tend to look, the sort of common default is already not a strengths-based one. So we need to work harder at this. And I think some of the examples coming out of First Nations Health Authority are inspiring.
We have two questions here from Emily that I'm actually going to answer quickly. She asked if we have any recommendations for analysts and epidemiologists about compiling data to look at the broader factors, and then also do we have recommendations and resources for analysts or EPIs around outlining feasible policy options. We have another on-demand webinar series that's happening, and in a couple of slides, you would have it in your PDF. It refers to this on-demand series of webinars, and one of the first ones is on assessment and reporting. And during that on-demand webinar, there are a number of resources in there about disaggregation and indicators, and which indicators to use, how to use those tools to support the actual analysis and compiling of the assessment and reporting plan. So Emily, I think I'll ask you to look at those, and then if it doesn't fit your need, to maybe email me and let me know. We had a question from Catherine about a resource for staff to consult or use for education. But I'm not sure if I totally understand that one. Maybe for their own education around reporting, right? And I guess some of what we've offered here probably would fit that bill. Maybe I'll go then to the next one from Judy. Do you think that it is part of our public health role to encourage or teach our stakeholders to present their information with an equity lens? Oh, good one. What do you think? Is that something that as practitioners we should be helping our partners to do?
For me, I think that we model, like the more we model it, the more it becomes part of the general public vocabulary. So I think it's part of my role. If I say that I'm a nurse, I'm a researcher, I'm a KT practitioner, and all of what I do is focused on supporting more equity-centered practices. So for me, it's integral to what I do, and I model it. I think it absolutely is my job and my responsibility to do. But I think that there are some, certainly in like the Canadian Public Health Association and health professions codes of ethics, there are many places where the commitment to social justice or health equity is reiterated. So I do think we have some responsibility. I don't know that I would want to say like that I always go with a teaching lens, but a modeling, a walking my talk lens is what I think is sometimes even more effective. I don't know, Bruce, what do you think?
You know what, that's exactly, you did a better job with the words than I would have, but that's kind of exactly what I thought. I can't see sort of you're right, a teaching or a preaching method working very well with a lot of our partners, but to constantly be modeling it and to show people the value and the importance 100%, and we have to be doing that all the time, right?
Yeah.
We had a question, so we have 3 more questions that I think we're going to race to get through. So Sasha was wondering, would using social marketing considerations for report writing be of value? So developing a piece based on what you want the intended audience to think, feel, or do, which I think is a largely part of what we were saying, right? Bruce, do you?
Yeah, totally, and I feel like that is maybe again a next step on our great big giant community health assessment or our public health report that's 600 pages. Out of that, we're taking some messages that we want to focus a little bit and say this is what action we want you to take, and those kind of things I think are really tailored to community presentations or you know, social media messages that go out. So I think for sure, knowing that we want to do those somewhere along the line and pulling those out to me, I hope that answered the question, but I would agree.
Yep. I think so. A quick question from Suzanne about the infographics, and wondering if we had comments about the use of infographics in the context of, you know, she says in the context of productivity. So in the issue raised that, you know, of looking just at the structural causes and not at the individual, and I guess the problematizing and not the naturalizing. And so therefore, how productive is it, I guess, to use some of these infographics that maybe just points out the problem? I don't know if I'm articulating.
Yeah. Maybe that. I wonder if she's talking about like moving towards more productive health equity action. Is that what she's referring to?
I think it was some of the infographics from SAC, but just in general, right? That you know, the use of infographics that tend to point out what the problems are, right? And tend to point out and not looking.
Yeah, I think that's like a. Yeah, it's a risk. So not only does it sometimes ignore or mask the structural, like the bigger, deeper roots, and make it easy to just draw. So if we're presenting that to people and we want them to be making decisions or changing what they do or shifting policy or any of those things, if we don't offer at least some beginning points for conversation or questions about whether is this acceptable, and if it's not acceptable, what are we going to do about it, and who's responsible for doing something about it? If we don't create some seeds for dialogue, or if we're doing it, depending on who the audience is, if we don't create some at least beginning feasible policy responses that people can work with and talk about when they're in those decision-making roles, then it can just fall flat and end up being another piece of like another presentation of a tidbit of data that sits in someone's brain for a moment and then leaves it because there's nothing to do about it other than, oh, okay, those people will have more burden of this. Like it can be, yeah, I don't know. Does that make sense?
Totally, and it's a great point. I think it's a good maybe reminder for all of us or people that make infographics and even a little bit dashboards that we don't want them to just be the sky is falling, right? Like have that second piece of the puzzle of possible actions or something like that, right? Where to go from here. That's a great one, yeah.
Thank you very much. I have put up a quick poll. We're going to have to wrap up. I'm going to ask people to tell us what they think. If they think that this will be relevant to the practice, then we can report that back to the public health physician. I think I am so thrilled with the discussion and the interaction from the audience today. I think we have some really wonderful and challenging questions, and I really, really appreciate the great discussions and the great ideas that we had today. So yeah, really, really active. I want to, this is the on-demand webinar series that I was referring to. There is one that is available now on assessment reporting on health inequities. Oh, sorry. And yeah, so this would be one to check out from going forward from this point. And we will have a recording of this presentation available through the PHPC members portal. We will be sending out certificates to those who qualify for the continuing ed, and this is a bit more about our NCCs for public health, and then we are specifically from NCCDH. So with that, because we're about to get kicked out of our portal here, I just want to say thank you to our speakers. This has been super fun to plan and just really dynamic and hopefully really applicable. So I can't thank you enough for your time and your effort and your ideas in doing this. So I hope that it was helpful for you too, and I hope that our audience and our participants found this useful. Please, please fill out the evaluation and let us know what you think and be honest. And if there's any other questions or comments, let us know. And with that, I will say thank you. And yes, and we'll close it there for now. Thanks very much.